Hello, everyone. My name is Dr. Yusof from Leeds, UK. I'm reporting for Room Now for EULA Congress 2021 this year. Today is the last day of the Congress. Therefore, there are still a lot more activities and abstract, to go through the Congress. So one thing that really caught my eyes is a poster number 0305 by Professor Michel Petri, looking at economic burden of mental health comorbidities in systemic lupus erythematosus. So, systemic lupus erythematosus, or SLE, is a chronic autoimmune condition which can affect various parts of the body, predominantly the skin and the joint. However, some patients also will develop other major organ involvement involving the kidney, leading to lupus nephritis. It can affect the lungs, the brains, and the heart. SLE is associated with multiple comorbidities and also increases risk of death. So what is already known from previous literature are that when we compare the care of people with lupus to the healthy individuals, the healthcare cost utility is markedly raised in people with SLE compared to the healthy individuals. What we still don't know, or there are limited data, is whether people with mental health comorbidities and also with lupus, whether do they have significant, whether do they require significant more resources compared to people with lupus who do not have mental health issues. So I think this is really an interesting topic to be dissected. So Professor Petris did a study on two large US databases. These they identify lupus based on the ICD codes and also mental health based on the ICD codes as well. They term mental health disease. There are four conditions. First is depression, second anxiety, third bipolar, and also for psychosis. So when they did an analysis of this cohort study, they found that the prevalence of people with SLE with mental health comorbidities were actually quite prevalent. So around 1/3 of the patients. So specifically 35 patients, people with SLE. And if we try to break it down in a subgroup of patients with lupus nephritis, there are about 29 people with lupus nephritis have mental health comorbidities. And the incidence as well is quite high. It's around 19% in SLE. Next, they look into whether people with mental health comorbidities, whether do they require increased healthcare utilization. What they found is people with mental health comorbidities and SLE, they have a longer inpatient stay, and they will also require more frequent outpatient visits. And astoundingly, they also increase the healthcare costs per patient per year around 2 to 3 times compared to those patients with SLE without mental health comorbidities. So this is really an important message and also an important key when we are looking after people with SLE because of the mental health components could be from the disease itself or also could be a consequence of disease. So I think we really need to support this patient, because it is a chronic condition. So I think patient need to be offered some support regarding to some psychological support. Also, they also can be directed to their to the lupus patient support group, so that they can feel supported about their condition. So I think that's a really interesting abstract that I found. I hope that you found it useful as well. So stay tuned with the room now for more videos and news updates. And you can follow me at my Twitter handle, Yusof. Bye-bye.